From United Nations Television, this is UN in Action.
A typical Friday night in downtown Montevideo, Uruguay's capital city. In this Latin American country, tango is part of the culture. So was smoking, until recently. In a move that set a precedent for the continent and for much of the rest of the world, in 2006, smoking was banned in every enclosed public space in Uruguay. Dr. Laura Roballo is a heart specialist and a member of CIET, Uruguay's Center for Investigation into the Tobacco Epidemic.
In our country, smoking is the primary cause of preventable death.
Uruguay now has some of the strictest anti-smoking laws in the world and is the first country in Latin America to impose such a stringent ban on smoking in public places.
Genera efectos vasoconstrictores. Por eso, el fumador.
Getting the message out on the health dangers to smokers came next.
El 80% de los hombres.
And in this macho culture, there were no holds barred.
Más hombre o menos.
More man or less.
These aggressive national and international information campaigns counterbalance the slick publicity from tobacco companies, who fear the erosion of their most lucrative markets. In late 2008, the Uruguayan government opened a new front in the battle against smoking. The total banning of any cigarette advertising in all media, including on the street. But advertising hasn't gone away. Eduardo Dreyfus, an anti-smoking activist and member of CIET, says tobacco companies continue to advertise their product on the streets, subliminally.
It's interesting to see how the colors and the design in the billboards that we found today are immediately identifiable with the adverts that used to be used on the street, especially on the kiosks.
Camela runs this kiosk, selling Nevada cigarettes, Uruguay's most popular brand.
It doesn't say Nevada anywhere. But people aren't stupid.
Tabare Vázquez is not only one of Uruguay's top cancer specialists, he's also the president of the country and the driving force behind the anti-smoking campaign.
At first, it seemed that we were on a mission impossible. But now there's been a noticeable reduction in the consumption of cigarettes.
But how many other countries have taken strict measures to protect their populations from smoking-related dangers? The World Health Organization estimates that only 5% of the world's population is protected by the kind of comprehensive legislation they have in Uruguay. And the developing world is lagging dangerously behind.
So what we are seeing now is that smoking is going down in developed countries, but is on the increase in developing countries.
Dr. Mirta Roses is director of the Pan American Health Organization.
We have noticed that where policies of tobacco control are being introduced in line with the World Tobacco Convention, then there's a reduction in the number of smokers.
The World Health Organization's Global Tobacco Convention requires governments to enforce anti-smoking legislation. To date, 164 countries have signed. But unless more countries follow Uruguay's example, millions of both adults and children could die from a tobacco-related disease. The next generation included.
¿Le preguntaste si quería fumar?
Did you ask him if he wants to smoke?
This report was produced by Jill Fickling for the United Nations.